Hello, and welcome back to another episode of Breathe, Darling, the podcast. I'm your host, Emily Riggs, and I am so happy that you're here listening with us today because this episode is such a needed one. We recorded this episode during Maternal Mental Health Awareness Month, and in particular, Maternal Mental Health Awareness Week. It is being released the week after Mother's Day in 2026, and I can't think of a better time to be talking about the nuances of grief and loss and hope than by discussing infertility and the journey to motherhood in particular. Today, I am so excited to be joined by Dr. Bridget Jones. No, not that Bridget Jones, but this Dr. Bridget Jones is a licensed clinical psychologist located in Dayton, Ohio. Bridget specializes in perinatal mental health, specifically infertility, pregnancy loss, and postpartum mood disorders. Dr. Jones received her doctorate in clinical psychology from Loyola University of Maryland. And while her training initially focused on child and pediatric psychology, her work in hospitals revealed a need for support among parents navigating their own anxieties and parenting challenges. Inspired by her own experiences as a parent, Dr. Jones pursued further training in perinatal mental health. Dr. Jones currently owns a private practice in Dayton and sees clients in Ohio and across the country. What I loved about this conversation with Bridget and what I believe you will hear as you listen is the incredibly kind and tender and gentle presence that she brings to this conversation about infertility. We both talk openly about our experiences, me with primary infertility, meaning with my first and so far only pregnancy, and Bridget with secondary infertility, meaning her first pregnancy came about as one would anticipate, and she had difficulty conceiving the next time. That being said, we really touch on navigating grief, shame, anger, and the uncertainty following pregnancy loss, and holding that tension between grief and hope as one navigates the infertility space and the desire to grow a family and that not happening in the timeline that we hope. I truly hope that this is one of those conversations that you feel seen by, that you can pass along to someone else who is struggling with this, and that it would help them breathe a little easier. We look forward to hearing your thoughts on this. And in the meantime, let's take a listen.
Well, Bridget, welcome to the podcast. I'm so happy to have you.
I'm happy to be here. Thank you for inviting me.
Yes, you have been a really sweet and special connection over the last year. I remember when you dropped into my inbox, I want to say it was about a year ago, and I honestly was like, is this for real? This girl's name is Bridget Jones. This feels like I'm being caught on camera, right? So this is a scam. But you have just been such a valuable connection for me, especially as I'm stepping into the perinatal space. I'm really excited to have you on as someone who has been here and has been doing it. So why don't you give listeners a little bit of an idea of who you are?
Yeah, well, thank you for that. And I know I think people a lot of times are like, that's not your real name. Like, what's going on here? I married into it, so I always say like it's my fault. But likewise, it's been so great to get to know you over the past year too, and as like a local resource.
Yes.
So yeah. So I'm from Dayton, so grew up here, left for grad school. So I am a licensed clinical psychologist, and I was actually trained to be a pediatric psychologist. So I worked in integrated primary care, worked with little kids, and I loved it. It was great, and I got amazing training. But then things changed, and I became a parent, and lots of things that I think we'll get to today occurred. And so I switched gears and realized how much parents need support, and specifically people who are pregnant need support, trying to get pregnant during pregnancy, right after. So I switched gears and I opened my own private practice in 2022, end of 2022, and have been doing that since, seeing clients for therapy who are trying to get pregnant, as I said, struggling with infertility, loss, And then during pregnancy and postpartum, so postpartum depression, anxiety, stress, all those things that are very typical during postpartum.
Yeah.
So it's been a great shift. I'm very glad I have shifted, even if it was as a result of lots of difficulty. And I'm very passionate about the population I work with, my clients. And I want to definitely be an advocate for perinatal health.
Yeah. Yeah. I feel like so many of us come to this work because of lived experience. Like, I don't know a lot of people who decided just to pursue perinatal mental health just
Yeah.
because they were interested in it. But, nearly every therapist I've talked to either on the podcast who's in this world or, made connections with outside of it, there really is that lived experience component that brings us into the work. And that's definitely something we're going to get into today. But I'm curious, what led you to become a therapist in the first place?
Yeah, it's a good question. And I never have a good answer for when people ask me.
Yeah.
It's something that I've always known I've wanted to do. Like, I can't remember a time when I didn't want to do that. Maybe when I wanted to be like an archaeologist in third grade or something, but
Sure.
things
Yeah.
changed. So I've always wanted to, this is a cliche answer, but I think help people. But more than that, I think everyone wants to be heard. And I love being able to provide that service.
Yeah.
And so I think I recognized that early, that is a strength of mine and that I wanted to grow that skill. And so I think I just followed that path.
Yeah. Yeah. I sense that in a lot of people who step into this field. It really is something that people naturally kind of came to them for, whether they felt like you were a really safe person who always listened and never judged. Like, I feel like that's a
Right.
prerequisite, right, for being a therapist, but also people who would naturally kind of come to you for advice or for support. And it sort of lends itself to having built some of these skills naturally. Obviously, our education and clinical experience is very important. But yeah, I feel like that really is the heart behind anyone who enters this work is I want to help people. I want people to feel heard. So I love hearing that from you. And then even just like stepping into the perinatal space away from the child psychology side of things and being like, gosh, moms especially are not feeling very heard. And you and I, we know the statistics around perinatal, whether it's mood and anxiety disorders or other issues that we might experience perinatally, but having someone bare minimum who can hold space for what you're walking through is huge.
Yeah, exactly. And I think if you want to, what I learned too is if you want to support children and families, you really need to start with
Yeah.
parents. And in my area, specialty, women and moms.
Yeah, absolutely. Well, I know that one of the things that we're stepping into today, and specifically as this podcast will be released during Maternal Mental Health Month, Women's Health Month, and Mental Health Awareness Month, is just like the intersection of who we are and who we work with, right? But I know something we really wanted to touch on today, as it's a part of both of our lived experience and the populations that we work with, is the topic of infertility. And, would love for listeners to get a little bit more of an idea of your story and what you bring to the table in this work
Yeah.
as the human on the other side of the screen or the other side of the room.
Sure. Yeah. So I would say, journey into parenthood and motherhood and struggles with infertility was a little up and down. So I actually struggled with secondary infertility.
Okay.
And who was born in 2020, mid-pandemic.
No, fun. Good
Very
time.
fun. Yes.
Oof.
Don't recommend.
Mm.
I got pregnant with him very easily, actually.
Okay.
And so I was like, oh, well, maybe this will be how it goes for me. How
Sure.
am I to, I've had peers and friends struggle with infertility prior. So like, okay, maybe this is not something that I will have to deal with. So I had my son, and then about a year-ish, a little bit more later, I was pregnant. I got pregnant again. And then this pregnancy I actually lost in my second trimester, around 16 weeks, which was incredibly traumatic, completely changed really everything for me. That was one of the factors that led me to switch into private practice and switch into this world.
Mm-hmm.
So I view that as really such a critical point in my really personal and professional journey.
Yeah.
So after that, it really just a little bit downhill and roller coaster from there. We took some time after that loss because it was incredibly traumatic, I said, and then tried to get pregnant again, had some difficulties, had another very early loss. And then through some intervention, I was able to get pregnant with my daughter.
Okay.
Following that, we tried to start to get pregnant again about 2 years after she was born, and then really struggled and never had a loss, never got pregnant. I ended up being diagnosed with endometriosis as a potential likely cause of some of this. So we ended up going through IVF after about a year and a half of trying, and I'm pregnant now with that baby. So hopefully we can see it to the end. I always have my fingers crossed given everything that we've been through.
Yeah.
So I would say my journey has been very, it's very bumpy. It looks maybe different and similar to other people's journeys. I think we think about infertility sometimes as that primary infertility of, it's really hard to get pregnant in the beginning. You don't have a baby, you haven't been pregnant before, which has its own real set of difficulties and is very difficult. And the secondary infertility where it's kind of the rug is swept out from under you a bit of, I thought path would be this way, and then it's different. So I'm very thankful and grateful for the pregnancies I have been able to have. So I'm so, grateful for that, but it has been a rocky road.
Yes. Thank you for sharing that with us. And I know you've shared with me privately and obviously cheering you on with this pregnancy. And I know that you've crossed some important thresholds in that, obviously feeling safe enough to share more
Yeah.
openly about it. But I know that that is such a scary thing, and you named it right from the jump, like having friends and family experience this and walk through this, and maybe not have your own context for it, but have so much empathy for that experience.
Yeah.
And as someone with the primary infertility, so first time
Yeah.
I tried to get pregnant, first pregnancy, 3 years of infertility
Yeah.
before that. And so I hold so much empathy for that. But then knowing friends and family who have struggled with the secondary, which I really appreciate you using that language of like the rug being pulled out from me under you because you knew what to do, you did it, and it worked the first time. There was no reason to believe that this would be hard the second time. And I think that that is potentially such a compounding factor here of like the war that we enter into with our body. It's like, wait a second, you worked before, something clicked before. What's not working now? What changed here? And, from the other side of like the primary infertility of, wait, I was told my whole life that this would just kind of happen. So much so I held off a little longer. I had no reason to believe that it wouldn't. And then it didn't. And no one could give me an explanation why. So really holding space in both of our stories for the primary, the secondary, the losses, and who we become in and through and on the other side of living with infertility. I'm curious, what was it like for you? And we're going to get into this other side of it, like as a therapist, and I know you've given some talks on this, like how do you support clients in infertility and conception as someone who's walking through infertility? So I want to get to that side, but even just your own processing of your experience of infertility. And what was it like sitting with the grief and sitting with the not knowing, like before you even had answers? Like what did you do with all of it? Like I imagine just like holding this like very ambiguous the bowling ball of emotion and just like I'm not sure what to even do with this. How do I put one foot in front of the other and move forward with this grief, with this knowledge, but still continue to live my life?
Yeah, it's a great question. And I think a lot of it is survival of it. There's no way out but through is
Yeah.
the feeling. And I know for a lot of people who have been through loss or infertility, people can identify with that feeling because there's often nothing else to do but keep going and put one foot in front of the other. And some days that's easier than others. And I think my difficulties with then getting pregnant after our loss was completely wrapped up in grief. It felt very tied to my son that we lost. And every month felt like such a reminder of that grief. So for me, which I know is not everyone's experience, but the infertility and the grief coexist together
Yeah.
in my experience. So it was very complicated. And I love control.
Yeah. Sure. Sure.
I, for people who love control, this is like a worst nightmare scenario of wanting something so badly and something is not adding up. Something's not, you don't know what that might be. And even if you know what it might be, again, your body or your partner's body or whatever the circumstances are, it's just not adding up to a pregnant baby. I mean, frankly, that was infuriating for me. It was
Yeah.
very hard for me to hold that because I think in every other situation in my life, even very difficult ones, I've been able to do something and to navigate and figure it out. And this felt very out of my hands. So with that, I think the tools that I relied on was talking to my support system. I had a wonderful therapist that I saw throughout this, and it was like small goals, one step in front of the other. But that didn't make it. There were hard days and easier days. It was still really challenging though, despite all of that.
Yeah. Yeah. Despite even having the support and whether it's your partner or a therapist or, honestly, your entire treatment team becomes your village,
Yeah.
right? I mean, your OBGYN, maternal fetal medicine, like infertility clinics. I mean, you name it, like you've got this team of people around you, but it can be a profoundly lonely experience.
Mm-hmm.
Was
Yes.
that a part of anything that you experienced walking through this?
Yes, it was, which I think is very, as you said, a very common experience because although people can be along the journey with you, even your partner,
Yeah.
it's your own journey that you are walking through. And so that can be lonely at times when even though people want to relate or give you words of encouragement, it's really you at the end of the day, waking up, going to bed, navigating these thoughts and feelings and all of it. And that's just you at the end of the so it can be very lonely, especially when I have an amazing support system, but I didn't want to broadcast it either
Sure.
because it was so difficult. And so yeah, I think I'm sure as you can relate, I think it is just incredibly lonely and isolating, even if you have a great system around you.
Yeah, yeah, I can absolutely endorse that. It was something that when we started trying to time it up around, and our kind of trajectory is probably atypical because we were married 9 years when we started trying, just kind of career and ministry and just like this whole past life I feel like I have,
Mm-hmm.
right? And then I was in grad school and we were kind of trying to time it up with like when I would graduate, just again, this illusion of control that
Yeah.
I thought I had. And so we didn't really tell anyone that we were trying. At that point, 9 years into marriage, people stopped asking, right? Like,
Mm-hmm.
kind of those first 5 years, people feel like they have a license to be like, so what's
Right.
happening here?
Right.
So I feel like we had kind of put a lot of those questions to bed. And and really kind of kept it privately between the two of us that we were starting. And then right in the first couple months of starting, my mom passed away. And that like grief, right, just like kind of threw this wrench into it. And then the grief started to compound because, 6 months later, I go to the doctor because it's not happening. And she's like, well, we're going to name it unspecified infertility. And I'm like, that's cool. That's exactly the amount of answers that I was looking for. Are you kidding me? And then that, right, kind of heaped on this sense of shame for me of like, what's wrong with me that this isn't happening? I really hadn't known at that time. I'd known a handful of people to walk through this, some of them family, some of them friends. And it just felt like this kind of space that I hadn't earned a right to step into yet. I hadn't earned a right to claim it yet. And I remember initially not inviting in the support system because I was like, oh, I just want it to be a surprise. I want this to be exciting, right? And then not inviting in the support system because I felt ashamed, and not inviting in the support system because I wanted to have control over something. And that was just even the narrative around this, around how I talked about it. And then I remember very close friends of ours sharing with us that they were pregnant, and kind of happened quickly. What anyone who's experienced infertility is like, I'm so happy for you, but like through like gritted teeth, right? And I just remember this like heaviness settling over me. It was Christmas-ish of 2020. Yeah. And just had to like clear the air with them and sit down and just say like, you don't know this because we haven't let you in on this, but this is like a bittersweet reveal. And here's why, right? Like navigating that space of like, how do I like celebrate this with you and also let you into the reality of my pain? And I think that that is just like this like duality of infertility, is wanting to be able to bring in a support system, but there's shame and there's unknown, and how many people can I really realistically update? But then also wanting to celebrate other people as they right take these next steps in growing their family and what that looks like. And it's so messy. And I think for those of us who love order and control and predictability, it just feels cruel.
Yes, that's
Yeah.
such a good word. I've used that word before, is
Mhm.
describing this journey of it, right? It feels cruel. I guess I didn't realize that your mom passed through
Mhm.
out in the beginning, it sounds like, of this journey.
Yeah.
I'm sure you also really can identify with the grief intertwined within.
Yeah. Yeah. It's actually just, you kind of sitting with creating a post around like motherless mothering. And even, right, like creating that, I realized just how intertwined it was to my story, because she didn't even get to find out that I was trying. She didn't even get, and there was never a version of my story that she wasn't going to be here for that. And so it really did have me there for a while, just kind of like shutting it all down. Like, I don't want to try, let alone, let's just be honest, like heavy, heavy grief, not really in the mood.
Yeah,
Not like, yeah, that sounds great. Let's
of
do that.
course. Yeah,
But at least that was my grief experience.
yeah.
But, I think I just needed to like completely step back from it. And this is that complexity of grief layered in here, whether someone has lost a parent or not, lost a pregnancy or not, is just the grief of, I'm grieving the life I thought I'd had. I'm grieving the timeline I thought I would have had.
Yeah.
I'm grieving who should be here and isn't. I know for friends and family who have gone through infertility and loss as a result, there's never a time when they're not like, this child would have been, 5. This child would have been, or because or not siblings, friends, kids coincide with the ages. So you're watching that child grow up, imagining what would my child have been like if I could have conceived and had a great full-term healthy pregnancy, or if I had been able to carry to term if I hadn't experienced the loss. So it's just so complex. And for me, you layer in the lack of my mom, and it just is, I don't know that there is any fruit in untangling it. Like, I think it's just inherently tangled up together. Right.
Yes. And as you're speaking to, there is just grief inherently in infertility
Mhm.
as well. So, yeah, the grief is then compounded if you've experienced a loss of some kind.
Yeah.
And there is just inherently grief in
Mhm.
infertility. I
Yeah.
think it just feels like a, loss. It can feel, I should say, to some people, like loss after loss. It can feel like
Yes.
the passage of time. I imagined myself
Mhm.
pregnant with the baby, and now
Yeah.
I'm not. Or here's another Christmas that I
Mm.
am not pregnant. And as you mentioned, it's this grieving of a life that you thought would happen, and it's not.
Mhm.
And so I think exactly right. I mean, you're speaking to it. Grief is so present in this,
Yeah.
whether there's.
Yeah, I almost feel like it's inevitable.
Hmm.
If
Yeah.
you experience infertility, there's grief.
I would
Yeah.
100% agree.
'Cause it's just life not going according to a plan, even if those plans were very loose,
Yeah.
right? I just want to have a family. Okay. And then we experience infertility and it's like, okay, is this even possible for me to
Hmm.
do biologically? Right. Uh,
Yeah.
and we know there are other ways of creating a family, and this doesn't negate those. But for someone whose desire is to be able to
Hmm.
carry a pregnancy, and they find out they can't, or there will be a need for significant emotional, mental, physical, financial investment
Hmm.
to make it happen. I know that when we had a year and then was diagnosed unspecified infertility, and then no one was really paying attention when I was bringing up concerns. It was just like, oh, we'll just keep trying, use some ovulation kits, like try to get a better sense of what's going on in your body. And I that another year goes by and still nothing's happening. And then I up the ante. I go to fertility specialists, and, they're saying, it can't be endometriosis. Like, you don't have most of the symptoms. And that was sitting on the back burner of my brain. And then they recommended, they're like, well, it's clearly not happening, naturally, meaning, right,
Hmm.
just via sex. And so why don't you guys try IUI? So intrauterine insemination. And they were transparent about how little that actually increases the odds of conceiving, but we were hopeful. It's a much less financial strain in terms of
Yeah.
like what the investment is. And we were very hopeful. And then I can remember taking, at the time I worked in a hospital setting, so I worked with some nurses, and I took my trigger shot to
Mhm.
work, and I asked one of the nurses I worked with to like stick me in the butt. Like, I'm like,
Yeah.
go ahead, Chrissy, do your worst. And like all of those feelings are so visceral, and
Mhm.
just even remembering them. But even when that didn't pan out, just sort of this like grief all over again. Like, okay, like we did the things, we did the tests, and it's still not happening. And
Mhm.
I think we were at a place of truly, do we keep going? And I
Mm.
think a lot of families experience that. How much more, not just of our money, but our time, our emotions, do we invest in trying? And it may even be taboo to like mention that, right? Because it's not giving up, but it's saying,
Mm.
I don't think I can do this anymore.
Mm.
And I'm curious, just kind of in your work and even in your own experience, like, did you ever face that?
Yes, completely. I think in when we were deciding whether to go through with IVF or not,
Mhm.
we were on this wait list, so we had a couple months to
Mhm.
sit and wait. And yes, it was definitely a very hard tension point for me,
Mhm.
I would say, of do I want to really do this? And do I have
Mm.
what it takes? This is an incredible financial investment. Not only that, though, it's been a lot. It's been a journey already. do I want
Mm.
to open myself up to whatever
Yeah.
happened here? So I really had to grapple.
Yeah.
Do I want to keep moving forward
Mhm.
because this image of my family is something I feel very passionate about?
Mhm.
Or should I come to terms with this is how my family looks and I am
Yeah.
incredibly grateful for it. I have more than many people do. Should I just
Mhm.
accept that?
Mhm.
So it was an incredibly difficult choice. And for many weeks during those months,
Mhm.
was grappling with that question.
Yeah. Yeah. What's it like for you with, and I think that as therapists, we face this on a variety of fronts, not just with infertility and our lived experience, but and what was it like for you knowing what you knew as a therapist, as a someone who specializes in right perinatal population, to go through it, to know what you know and still experience it? I think the
Mhm.
caveat with that is I think a lot of times as therapists, we can experience shame because we know this. And I'm pointing at my brain for anyone who's
Mhm.
listening to this as opposed to watching it. We know it mentally, cognitively. We know the skills. We could sit here and ramble them off right now. We could spend an hour, right, talking about different interventions and that kind of thing.
Mhm.
But it's another to be a person experiencing it. What
Mhm.
was that like? Were your identities feeling really separate at that time? Or did you
Mhm.
feel like you were able to integrate what you knew clinically with your experience in real time?
Right. It's a good question. It was definitely, I think about that DBT wise mind of, and here I am intellectually,
Mm.
but I was definitely in that's like the rational part of my mind of,
Yeah.
okay, this things like this happen. You can do this when you're feeling this way. And it's very normal to feel this way. And you talk with people all
Mm.
day, every day about these feelings, and it's okay. But in the emotional part of the mind, the experience
Mhm.
of it is very different. And so
Mhm.
I think having that knowledge definitely helped me, was a protective factor. I could rely on that.
Mhm. Mhm.
And nothing takes away from the feeling of
Yeah.
grief, anger,
Mhm.
lostness,
Mhm.
depression, whatever it may be. And so sometimes that tug between my
Mhm.
rational mind and my emotional mind was difficult. And honestly, the emotional mind won a lot of times because
Mm.
I am just a human at the end of the day.
Yeah.
So
Yeah.
I would say to wrap, I guess to put a smaller point on it, it was helpful to have that knowledge.
Mhm.
But I think as anyone who's been through infertility or loss before is the experience of it is just something different.
Yeah, yeah, absolutely. And I think that's where it's so important that we also name it's going to be very, very different depending on the person, right? This is an
Mhm.
incredibly personal, intimate, subjective experience for each person and how they process it. Like I go back to grief, right? There's no wrong way. I
Mhm.
always say to any of my clients, as long as you're not hurting yourself or someone else, there's no wrong way
Mhm.
to experience grief.
Yeah.
And really, if we're honest, most emotions, right?
Mhm.
And so, I think it's really important that you're acknowledging that. And I am curious, like with leaning more into the emotional response, as did I in my own grief journey. But was there something that you maybe surprised you about the emotions that came up for you, or something
Mhm.
that you didn't expect, or maybe were humbled by?
Yes, I think it was the fact that I wasn't surprised by my emotions. I tend to be emotionally expressive in my
Mhm.
personal life. So I wasn't necessarily surprised by the emotions I was having, but I think the real difficulty managing them was surprising because I usually have been able to, and historically, ways to manage the emotions that are coming up or to,
Mhm.
have a difficult day, but move through it. And that wasn't
Mhm.
here. All the
Mhm.
go tos, my tools that I typically
Yeah.
use weren't as effective. And
Okay. Yeah.
that can feel really hard eh, in a moment when you desperately need it, but it's not the management of
Mhm.
happening. And there's that other thought of like, I do this every day. I tell people what to do to
Yes.
manage this
Mhm.
every day.
Mhm.
And here I am, and it's totally in control of me. And the emotions were not surprising, but the difficulty I had managing them and how
Yeah.
foreign that felt to me was
Yes.
really uncomfortable.
Yeah. Yeah, absolutely. I think it's really important that we name that as therapists, that there's that moment of letting ourselves be human.
Mhm.
And yeah, I'm hearing you say like it wasn't surprising to feel something about this, but it was surprising that I felt out of control. Like I felt like, and again, here's that control,
Mhm.
right? Like we want to feel like we've got it on lock, right?
Yeah.
But for you, it sounds like there was that humbling factor, and I know for me, it's only helped me have more compassion for my clients who are struggling to implement a change or try something different or remember to use a skill. It's like even I don't, right,
Mhm.
remember to use what I know, which again is just a very human response. But it
Mhm.
does sound like in a big way, this experience changed you.
Mhm.
How
Yes.
would you how would you kinda characterize how you're different after walking through what you have?
Yes, I think the question is, how am I not different almost? It
Totally
really,
fair.
again, if for people who have been through it, I'm sure everyone can relate. It's all encompassing. And so
Mhm,
it's physical, it's psychological, it's cognitive, it is
mhm,
generational. It's so much that encompasses this journey. So I do feel like it has changed me in all of those aspects. I think
mhm,
professionally, it has made me way more equipped to work with the population I work with because that
mhm,
deep empathy and understanding is there while also knowing
mm,
everyone's journey is different and
mm.
can't totally know what this other person is feeling, but I can really be in it with them and have a really an
Yeah,
understanding of what that feels like or might feel like. So professionally,
yeah,
it's shifted everything.
yeah,
And personally, it's just taught me so much about what I'm capable of, about what
mm,
grief really feels like, and navigating
mhm,
it forever, because really it never goes
mm.
away. It has shifted how I view parenting and
Sure.
being a partner. So I show up differently in the world, maybe a little bit more scarred, but more real, I would say, and
Yeah,
understanding than I ever have
yeah.
in many ways.
Yes. Oh my gosh. It sounds like what we know about suffering, right? It
Mhm.
changes us and it inevitably changes how we see ourselves and other people and the world around us. And
Mhm.
I truly think that it can. I'm drawing on the work of Andi Kolber. She's the author of a book called Try Softer. And what we've walked through and really has the potential to both harden and soften us, right? And like hardening us in some areas where, like you said, I kind of feel scarred. I feel like there's a calloused side of me. I've
Mhm.
had to practice some detachment from my experience just to get through and just to survive. But then there's a softening too, like a tenderness for other people who have walked through something similar, who are walking through the unknown, who are walking through the loss, the grief. And I don't know, I do think that there's something beautiful about both sides of
Mhm.
that, right? And kind of like what you were saying, like it's shown me what I'm capable of, but it's also completely changed me from the inside out, which is just what motherhood does, right? We're both familiar with the idea of matrescence, right? The transformational change that we go through as mothers. But I think even just the pursuit of motherhood, like I often talk about the work that I do as supporting women both to and through motherhood. And even naming out loud, this is something that I want, I think changes you.
Mhm. Yes, that's such a beautiful way of putting it, of the callous, the hardness, and the soft,
Mhm,
and that dialectic there, and a whole
mhm.
both of
Yeah.
it is
Yeah.
both are present in me as a result of all of this.
Yeah. I'm curious, and as we're kind of shifting toward the work that you do with your clients in this space, I'm curious, relationally, particularly with a partner. And if you feel comfortable speaking on your own experience with your partner or just kind of in general, your work with anyone, clients who are partnered walking through this, the person who is not, like we often call them clinically, the non-gestational partner, right? So the person who is not seeking to carry the pregnancy or who's actively carrying the pregnancy. What's been your experience of walking with the partner and their experience of infertility?
Mm,
Because, right, we know just because it's not happening in their body. I
mhm,
often think about this like with my husband. Like the day I lost my mom, he also lost his mother in law. It's a
mm,
different relationship, but it's still profound. And
mhm,
so the day you experience the loss of your son, or every time that 2-week wait resulted in a negative test, that has an implication for the partner as well. And I know
mhm.
we're both coming at this from heterosexual relationships, right?
Right.
So our partners are male, but just curious what you see and what acknowledging the partner's experience of all of this is like.
Sure. Yes, I think it's similar to what you had said earlier about everyone's journey within this being their own, depending on
Mhm.
where they've been, their own experiences of loss, how they identify as a partner, a support system. So I think it depends on a lot of those factors. But I do think,
Mhm.
right, for partners, it is a difficult position to be in. Talk about control. You'll
Mhm.
likely very out of control in many ways.
Mhm.
And, I know a lot of partners want to show up for their partner who is actively trying to
Mhm.
conceive in their body, going through pregnancy,
Mhm.
trying to go through pregnancy. I know a lot of people, it's difficult to be like, how do I show up for this
Mhm.
person while I'm also dealing with a loss
Yeah.
myself, while I'm also actively grieving and managing my emotions around all of this too.
Mhm.
So I think partners, of course, feel it very deeply,
Mm.
and it's just a different experience. It's maybe not so much
Mhm.
physical, quote unquote, for them, but
Mhm.
it is, again, you imagine your family, you make a decision to
Yeah.
start your family, and then that dream is quickly changed.
Mhm.
And
Mhm.
a very similar thing for partners, an ongoing grief, while
Mhm.
also, okay, I'm kind of the support, quote unquote, partner here in some ways, but I'm also going through
Yeah.
too. So
Yeah.
it can be challenging for part.
Yeah. Yeah, absolutely. So, Bridget, in your work, what would you say is the most helpful thing that clients, kind of endorse as like, this is what's actually been helpful? And what do people think is helpful, like from a support system perspective, that just actually is not?
Sure. It's a great question. So I think a lot of people going through infertility, going through loss, really at the end of the day, just want, almost similar to what I said in the beginning, to be heard and
Mhm.
listened to,
Mhm.
and just have someone walk the journey with them
Mhm.
instead of a support person providing advice or their perspective or their own experiences. I think for a lot of people going through infertility, as we mentioned, it's very lonely and it's very
Mhm.
difficult. Feels like no one really can quite understand. And then if you have people who the intention is very good, but saying things like, just don't stress, or everything happens for,
Mhm. Oof.
or
Yeah.
it'll happen,
Mm.
go on vacation, or like, don't worry, like this will
Mhm.
happen. The intention is so good.
Mhm.
And the impact of those statements can be very
Mhm.
invalidating for
Yeah.
people. And so I think for a lot of people, really all they need to hear is what you're feeling is okay, is understandable.
Mhm.
This is so
Mhm.
hard. Even sometimes
Mhm.
I find it, I say this in my therapy sessions all the time. I say, this sucks. This
Mm.
totally sucks. And
Yes.
that might sound funny, but that's nice to
Yeah.
hear. Sometimes hear
Yeah.
that people, it does suck.
Yeah.
This is
Mm.
really hard. And so I think
Yeah.
it
Mhm.
doesn't need to be turned into a positive
Mhm.
note or be
Yeah.
wrapped up in a bow, but we
Yes.
do need to listen and just say, I hear you. And it's okay to feel that way.
Mhm.
Really unfair and hard.
Yeah. Yeah. I know for many people too, the sentiments, right? The kind of overused aphorisms, really fall flat, but it's actually the practical support that feels really good.
Mm-hmm.
I'm struggling with this and I have other kids. What? Please offer to spend time with my other kids so I can take care of myself, right? Show up with a meal. Like I often say, especially in grief, like I'd rather you show up than not at all
Mm-hmm.
and guess, especially if I don't know what I need, just go ahead and guess. That's fine, right?
Mm-hmm.
But, especially with like the overt statements, just holding that space for quiet and support and just being willing to sit in the mess with that person and not fix it because they've tried everything.
Yeah.
There's no new idea that you could offer them that a doctor hasn't already or they haven't Googled themselves, right? And so really being willing to just hold that space with them and be a safe and supportive presence, much like you just said, I think it is huge. Yeah.
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 Well, I would love if, just one final thought that you could offer listeners, particularly those who are just in the thick of it. They're in the waiting room. They're in the bathroom after a negative test. They're in the silence after another hard conversation of, do we keep trying? Do we keep doing this? What do you want them to walk away from this conversation with?
Yeah. I would love if people walked away with, I'm going to reiterate, feeling heard of this is a really hard thing to go through as a human.
Yeah.
And it is really hard, period. Hard because and it doesn't always get wrapped up in, a perfect way. And so if you're in the thick of it, there is, again, no way out but through. And so what do you need to do that? And I often go back to it's these small goals that you're working towards. I remember after I had to go back to work, I was also working in a hospital after my loss of my son. And I was in the parking lot sitting there, willing myself to go inside that first day back. And I said, okay, just have to get to my office. That's all. And then once I was there, I was like, okay, I gotta just get to these emails. And so we're talking, even if it's minutes, if that's all you can do, then that's what you do. And the pain go away. But it is, okay, how do I preserve myself through this really difficult process?
Yeah. 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 This lends itself to a lot of just compassion and grace and just tenderness with yourself, right? That like being harder on ourselves isn't actually going to make this any easier and just meeting ourselves with a lot of that just softness that we mentioned earlier. So, well, Bridget, thank you so much for just sharing from your personal experience and from your clinical expertise. I really feel like this is going to meet a lot of people where they're at, if they are right in the thick of it, or if this is just a part of their experience that maybe hasn't been processed. They haven't let themselves really open that up and explore it. I really hope that this just meets people where they're at. And thank you again for being here and for sharing with our listeners.
Yeah, thank you so much for having me. It's been such a privilege to talk about this. So thank you.
Of course.
Thank you so much for listening to another episode of Breathe Darling, the podcast. It is my hope that you walk away from this conversation with Dr. Bridget Jones all about infertility and how it impacts our identity, our relationships, our mental health, and what support actually feels helpful during infertility and grief, that you walk away feeling equipped to either care for yourself with more grace and compassion, or to extend more grace and compassion and understanding to the people in your life wrestling with this. This is not an easy conversation. This is one of the hardest things that I have ever navigated, and have watched and loved people as they have navigated it. But the more that we can talk openly about it, the more that we can sit with people in their pain, the more bearable it becomes. So friends, be sure to share this far and wide. Let someone know that you see them. Let them know that you want to understand, you want to hold space with them. And in the meantime, we invite you to subscribe to the podcast wherever you listen, Spotify, Apple, or on YouTube. Subscribe, leave us a review, leave us a comment. We would truly love to hear your thoughts on this episode or any of the episodes we've released so far. By following, subscribing, commenting, reviewing, you are helping us to reach more people with the message of Breathe Darling, which at the end of the day is about having honest, grounding, connecting conversations that help us breathe a little easier. In the meantime, friends, take good care and breathe easy.